Welcome back to the Caribou Data Science channel. It is the evening of October the 7th, 2020. I'm getting ready to look at some new data. This data is from the it's from the Washington University Institute for Health Metrics and whatever the E stands for. This seems to be the site that is the group it's cited in in two stories I've seen as far as COVID-19 models and predictions. Those are articles. One article in August, I think it was to uh, NPR.com, and then in September there's an article by USA Today quoting another number, COVID-19 deaths from this organization. They basically have two data sets. You can get them by there. Let's take a look at the FAQ first. Yes. How many overall deaths will there be? Well, our model is updated to account for new data and information, and the estimates may change as a result. For the latest estimates, visit our COVID-19 projections tool. Why do your results show a wide range in the forecast for deaths? Large uncertainty intervals or the range which estimated deaths are likely to fall can occur because of limited date availability, small studies, and conflicted data. A smaller range generally reflects extensive data availability, large studies, and data that are consistent, and so forth and so forth. Okay? So let's create a new repository, new Git repository. Since this is a 19 Washington, okay, let's call it the IHME data from Washington universities. And that's the IHME, is that what we said? Again, that's Institute for Health Metrics and something. Education. Choose license, add Ruby tile. Okay. So, okay. So it's just the Washington University's Institute for Health Metrics and something or other. I'll call it. So that's really all I'm going to say about that. Okay. Commit changes. Okay. And let's create a new repository for this. Okay, let's come back over here now. Okay, let's come back over here first. Back over here. Let's just for fun. Let's just create a new. Let's just create a data directory, shall we? All right. Let's come back over here. Take a look here. Take a look here. Let's just copy all these. I probably should actually look at the. Okay. So let's take a look at this data release information. Data summary, mortality, infection, testing, hospital use, and social distancing projects. That's good. Are you going to tell me it's variable information, location name, name of the country or subnational location, date, the date, uh, all bed mean, the mean COVID-19 beds needed by day, all bed lower, the lower uncertainty bound of the COVID-19 deaths by day, upper, the upper uncertainty bounds of COVID beds needed by day. ICU bed mean ICU COVID-19 beds needed by day. So I would think if we saw, we should see these bed numbers decreasing over the last 6 weeks because, well, we have fewer deaths. Okay, anyway, ICU bed lower, uncertainty bound beds needed per day. ICU bed upper uncertainty bound of the invasive ventilation needed by day. Lower uncertainty bound of invasive ventilation by day. Under upper uncertainty admits mean the mean hospital admissions by day that should decrease, right? Uh, admits lower to lower uncertainty, upper uncertainty. New ICU mean the mean number of new people going to ICU by day. Lower uncertainty bound of numbers of people going to ICU by day. Upper uncertainty bound a number for new people going to ICU by day. Bed over means COVID-19 all beds needed, total bed capacity, average of all bed usage, so forth. Let's see, COVID ICU beds needed minus total IPC capacity. That's interesting. Okay. Lower uncertainty deaths mean daily COVID-19 deaths. That's what we're looking for. That's lower uncertainty bound of daily COVID-19. And observers watching from the ground said it looked like it was. Okay. Upper lower deaths, interesting, I'm not sure. The mean cumulative COVID-19 deaths, the total lower uncertainty bound for the cumulative. The mean cumulative is something I was thinking about. That's kind of interesting. The mean daily COVID-19 deaths, smooth. The lower uncertainty bound, the mean cumulative COVID-19 deaths, smooth. Lower certain uncertainty bounds. Mobility data indicated a certain mobility composite observed. Total test data type indicated whether total test composite is observed or projected. Total test. Observed data only. Confirmed infections. Mean estimated infections. Lower uncertainty. Uh, best mask hospitalization all locations. Universal mask. Worst hospital all locations mandates easing. location name, date, deaths mean daily COVID-19 deaths low, deaths upper, mean cumulative total deaths, total lower deaths mean smooth, daily mean COVID-19 deaths smooth, cumulative COVID-19 smooth, upper certainty, total test, observed data only, mean estimated infections, summary stats, all locations, name of location, mean peak bed use date, peak bed day lower uncertainty, bounds, upper uncertainty, mean peak ICU bed use day, lower uncertainty bound for ventilator use, upper certainty bound for peak ventilator use date, mean peak ventilator use, lower uncertainty bound at peak ventilators use date, total number of beds that existed in each location, total number of ICU beds, average number of total beds used normally, all bed capacity, ICU bed capacity, start date for severe travel restrictions, end date for severe travel restrictions, start date for people ordered to stay at home, start date for educational facilities closed. This is interesting. But evaluation. Okay, so that looks kind of interesting. So what we have here is like some really long uh, so there's a couple things we could do here. You could simply leave them as text files, read them in, probably the first place to start. Uh, let's just take a look at. Let's take a look here very briefly at the field names and a few other things. Okay, you can tell how large this thing is by the number of how long it's taken to load. Okay, location name, Abruzzo, date, location ID, death mean. Okay, so the total. Well, this is good because it appears that the okay, so it appears that you could say let's do a sort here. Let's do a reverse. Okay, so those titles all look right. I mean, those column headings all look correct. I'm mainly looking to see if I need to fix any of the column headings, okay? So that's really all I'm doing here. No, honestly, the quickest way to do it would be to do it using sed at a command line. But they appear to do a good job with names using underscores. Very good. We're also going to have some very long names. Okay. Good job. Also, good job with the date formats. Very good. So the question is this: do we create an entire separate database because there's so much data here? once again. Okay. So the initial examination of data is actually very good. I mean, they're using underscores for column names. The dates is correctly formatted, 4 digits. Date, 2 digit month, 2 digit is separated by hyphens. So that means R is going to be very happy with this. Very happy with this. Well, the question is this: do I use this? What I may do is start out with a summary stats reference hospitals mask. Okay, so the question is, how do we rename these things? Um, I honestly don't see a lot of data I can take. In many ways, this would be an ideal candidate for using command line tools, either the R tools package or the command line tools on Unix, Linux / Mac OS. Cut, for instance, to be outstanding here. You could say, "Oh, I only want these 4 things." But the question is, how are we going to? Okay, okay. We'll take a brief pause here.